And then this one is on an as-needs basis.
Mar Davies says she was shocked to learn through her doctor that Shoppers Drug Mart billed the government for a MedsCheck on her.
I was angry because I knew that I hadn't had one. I happened to have gone into my doctor about a month after this had happened. I found out about it. How many other people have had MedsChecks charged to them and they're not aware of it?
She says the pharmacist told her they'd reverse the charge. Allegations of improper MedsChecks at Shoppers and corporate pressure to hit billing targets for them has prompted some to take a closer look at the program. The issue was revealed in a recent CBC Toronto investigation. At the time, the company's president denied the pressure and any use of corporate targets, but pharmacists and documents have said otherwise. The body that regulates pharmacists in Ontario says it's now tracking MedsChecks complaints specifically related to pressure to meet targets and looking to see if previous complaints also fall into that category. It's working on a report based on responses from a survey and town halls where pharmacists shared their experiences with corporate pressure.
It's heartbreaking to watch. There isn't any question that this profession is in crisis.
While the college licenses pharmacists, it doesn't have authority over the companies they work for, but it's retained legal counsel to explore its options.
We are looking at things like accreditation standards that require business owners to demonstrate, or for us to be reassured that the business will be run with integrity.
The Ontario Pharmacists Association says it's meeting with the government in the coming weeks to discuss potential changes to the program. The CEO says he'd like to discuss alleviating the administrative burden, the possibility of expanding it to a chronic disease management program, and changing the eligibility to possibly 5 medications instead of 3.
What I'd like to see is the proper use of how we go about measuring success and health outcomes being a big part of that, rather than necessarily driven by a bottom line. There is benefit to the system and patients when it's done appropriately.
Sony Polo says that's evident at his pharmacy.
So this medication is going to make you a little bit drowsy.
Where MedsCheck is done nearly every day because they cater to patients with chronic conditions.
This one is a very valuable program, and we could avoid a lot of other health issues. It's very, very important to use this kind of programs appropriately, and the patient benefit should be the primary focus.
Since CBC Toronto's reporting, Ontario's health minister said she's asked the ministry to review the program, but it's unclear what that entails. Last week, she said all pharmacy programs are constantly monitored.
We assess those programs to ensure that the intention is actually making an impact for patients and for the system as a whole. We'll tweak when it's appropriate, but to ensure that the programs actually are providing the necessary oversight for patient safety.
Documents obtained by CBC show since our reporting, Shoppers Drug Marts in Ontario have an updated procedure when it comes to MedsChecks, including a more robust documentation of patient consent. In a statement, the company told us that MedsChecks are vital and can help save lives. Angelina King, CBC News, Toronto.